Bismillahirrahmanirrahim. Today we are discussing a very important subject. It really need some of the understanding, especially the clinicians who are utilizing this test, which is BNP, ProBNP, NT-ProBNP. These are the three terminologies commonly used or three categories of BNPs which are used in clinical practice to understand and to order test. So what I'm suggesting, I'm just clarifying what are these things. BNP actually called brain natriuretic peptide. Actually, it's not releasing from brain, it's from heart. It's initially in animals, it was found in the brain. That's why it was labeled brain natriuretic peptide. Now, if you just look on to the status, how it release, what is pro-BNP, pre-pro-BNP, and what is BNP, and what is NT-ProBNP. This slide will clarify you these concepts about this thing. If you look on to how the pre-ProBNP is released from the myocardium, whenever you have a stretch to your myocardium, you're going to have the release of this pre-ProBNP, which is actually a combination of different amino acid. It first form into ProBNP, and still it's in the myocardium. Now remember, this stretch is causing the formation of this ProBNP, and when this ProBNP is released from the myocardium, you see that it breaks down into two parts, which is NT-ProBNP and BNP. Now the next slide will clarify you, and this BNP has all the actions. This NT-ProBNP, which is released or cleaved from this ProBNP to separate out the BNP and NT-ProBNP, it's just there in inactive part. And that's why this inactive NT-ProBNP is so useful whenever you're ordering test. And next slides will show you that. Like this. You can see that this is the status that your pre-ProBNP. This ProBNP is going to cleave down at this stage into BNP and NT-ProBNP. And let's see now, that's the active part, the BNP, and NT-ProBNP is the inactive part release. And how both of them are different. So whenever you're ordering this brain natriuretic peptide BNP, ideal should be NT-ProBNP, not the BNP. Why? Let's see. These are the differences between the two. Very important to understand. As I already described, that BNP is hormonally active. So the function is governed by this BNP. And this NT-ProBNP just a breakaway cleavage chain of this BNP, which was released from the cardiac myocyte. So it's hormonally inactive. BNP, rapid elimination from the circulation after release within 20 minutes. So not a persistent remaining marker, not good for testing. While the NT-ProBNP after release detectable in blood for several days with half-life of 60 to 120 minutes, so more reliable. Concentration in blood depends on the momentarily variable of ventricular function and the patient situation at the moment. While cumulative concentration reflects the whole cardiac stress of the patient, so again, more reliable as compared to BNP. Relatively low plasma level, high plasma levels. Less sample convenience, more sample convenience. That means even if you take the blood of the patient and you are keeping it stored to send to the laboratory for investigation, it's more stable. You see here that BNP has instability in plasma, 4 hours at room temperature and 24 hour, very high stability NT-ProBNP. So again, a good indicator to really work on, or to send and to do higher intravascular individual variations, lower variations. So just, and this is again a very important point, the last one, which is the drugs nowadays, Cicritil, Valsartan, Opivio, or Impresto, or its generics. The BNP, since it's the active compound, and this active compound actually is degraded by neprilysin, while NT-ProBNP has no effects, or neprilysin has no effect of NT-ProBNP. So when you're using neprilysin inhibitor in a patient with heart failure, it certainly will causes false increase in BNP levels, because neprilysin you are inhibiting and BNP will be raised, while this NT-ProBNP will remains the same. So this sacubitril valsartan combination use is not going to affect the measurements of NT-ProBNP, but it will affect the measurements of BNP. And that's very important nowadays. I'm still seeing a lot of reports ordered by the doctor of BNP on patients, or for patients who are on this sacubitril valsartan combination. Your findings wouldn't be right. So I hope this small little presentation will help you in understanding the difference of BNP and ProBNP and NT-ProBNP. I'm just quickly summarizing. The cardiac myocyte stretch leads to the formation of ProBNP into BNP and release into the circulation. When it comes to peripheral circulation, this ProBNP cleave down into NT-ProBNP and BNP. And in these two combination, NT-ProBNP is an active compound, while BNP is the active compound which is going to act and work on the natriuresis, vasodilation, all the effect of that brain natriuretic peptide will be with BNP. So when you are assessing different things like diagnosis, prognosis, your treatment management, and all the things, you should be taking care of, you should be measuring NT-ProBNP, not the BNP, because drugs are going to affect, especially sacubitril valsartan is going to affect his measurement, because that neprilysin only affect BNP, not NT-ProBNP. So hope this presentation will help you in understanding and utilizing this BNP and ProBNP into your workup of cardiac failure. Thank you very much for listening.